Now I do want to pick up the pace here because we're running behind. And here's another one I want to throw at you, Dr. Rob. So, Greene County Hospital is set to end their labor and delivery services at the end of January of next year, forcing pregnant women to travel 30 to 45 minutes to deliver at hospitals outside the county. Hospital leadership says staffing shortages and long-term financial losses, driven in part by Medicaid cuts and low insurer reimbursement, made the service unsustainable. Prenatal, postpartum, and other women's health services will remain local, along with perinatal navigator program to help patients transfer care. The hospital's emergency department will remain prepared for unexpected labor cases with continued OB training for ER staff. Hospital officials warn the closure reflects broader threats to rural healthcare access in Indiana if Medicaid reimbursement and insurer accountability do not improve. Now, Doc, you handle end-of-life care a lot in your line of work, and we're talking about beginning-of-life care here, but in a way, it's all a reflection of a breakdown in our rural healthcare system. And that's precisely due to Medicaid cuts, is it not?
That's the biggest driver. And, I delivered a few hundred babies back in my day. So it's something I care about personally as well. And I've got children and I've got grandchildren who were born at home with midwives and on and on. But the situation in Greene County is particularly tragic and part of this pattern. So again, if you just look close by, the first the first nearby hospital that stopped OB care was Monroe Hospital. When they first opened, they did OB for a couple of years and then they stopped. And I think that was probably actually a good idea because you do want to have a certain amount of business that allows you to kind of, have all the protocols and know what to do when things go wrong. So consolidating from Monroe to all the OB care at Bloomington Hospital, that itself I thought made reasonable sense. But then go a few years forward, actually around that, before Monroe Hospital opened, the two hospitals in Bedford, so we're talking about Bedford Regional and Dunn, they made a decision likewise to consolidate OB care in one of the hospitals, and they chose to do OB care at Dunn. Then Dunn was bought by Ascension, which is a national Catholic chain, and then just what was it, 2 years ago, Dunn announced we're going out of business completely. And so that means all OB care in Lawrence County is gone. And then actually even maybe around that same time, maybe a year before, in Martinsville, again, these are just, close by places. In Martinsville, they closed the hospital, they closed the OB, but they kept open a 24-hour emergency room. And in some ways, it made economic sense. But that's the thing is all these crazy decisions make economic sense when that shouldn't be the reason. It's what do we as people need? Yes, Greene County is responding to economic pressure and closing down OB, and there's no upside, like I talked about when Monroe sent their OB, or when there's a certain amount of consolidation that's not bad in terms of healthcare. But in this case, not only we're asking pregnant women to be transported an hour away in labor, which just, makes me kind of tighten up in my abdomen. And I'm a guy. But then you think about, and what about prenatal care? So they're going to have to go an hour to get to their prenatal appointment. They're going to.
Well, they say that stuff's going to remain in house, but it's still the effect. The underlying root of this is that we're treating these things that should be public services as businesses, right. And we're worried about the bottom line, and they have to remain economically viable. And it's not just, hey, communities need hospitals. Yep. Period. We need to provide services to people in these places. The economics be damned. And we're just handling this entirely the wrong way.